So hey guys, welcome back to the drxvlogs podcast, and today's podcast is gonna very special for us
because we have a very special guest with us. She is Dr. Aliza Jones. She is clinical pharmacist in Max Healthcare Hospital, Delhi.
So in this podcast, we are covering so many common questions asked by you guys, like what are the job fields Pharmdians can explore?
Yes, and what are the duties we perform as a clinical pharmacist in a hospital?
And most important, prescription rights for Pharm.D.
Yes. So let's start this podcast without any delay. And
Hello ma'am, how are you?
I'm great. How are you guys?
We are good. So welcome on the drxvlog podcast, and we are very excited to carry forward this with you.
So, ma'am, before starting this podcast, I would like to say about our channel. My channel name is drxvlogs, and I started this channel in after COVID. And my main aim is to spread awareness about PharmD and the pharmacy professionals.
My first question is, ma'am, can you introduce yourself for the audience?
Okay, before introducing myself, I would like to say that you guys are doing a very good job.
Thank you, ma'am.
Like those students who are not knowing anything about PharmD and those who are in doing PharmD but don't know anything about their future or anything. So it is very good that you guys are doing this channel and all the videos I have seen. Okay, very good job. And going to my introduction, I am Dr. Ellis John. I am working as a clinical pharmacologist in Max Healthcare Hospital, Delhi now. So I have been graduated in 2022 from Education College of Pharmaceutical Science. It is in Trivandrum, Kerala. And I joined here on January 2023, and now being 1 year I'm here. Then that's all about me.
So, ma'am, my first question is, what is your overall PharmD experience?
Okay. My overall PharmD experience is till my fourth year of PharmD, I was not having any idea about PharmD. I was just going through the textbooks. I was studying and I was getting good mark, academic marks. Everything was fine and it was going very smoothly. But after fourth year only, I came to know that what is PharmD, what is the future of PharmD, and what job opportunities, about everything. I started thinking about that after fourth year. Then I got an internship in climate research solution. Dr. Ajit Singh is doing that. So I got an internship. It was a virtual internship. Then I got many friends all over India. And then I came to know about each and everything about PharmD. Just academics or just studying, updating our knowledge. It doesn't mean like updating our knowledge, you will get a good job or you will get a very nice future in PharmD. So it is like we need skills as well as along with our academics, along with the knowledge, we need skills and other things, presentation skills, everything we need while we are going through PharmD journey. So this is my experience in PharmD. Like it was I was very depressed on my fourth year when I understood that PharmD is nothing or PharmD is just a very bad course. Like many people told me like that. So family is we won't get a job. We won't get a good job in India. Something.
So you are in fourth year in depressing stage.
Yeah. Till after fourth year, I came to research and I got many friends all over India through that internship. Then I called them. I asked them about PharmD, what they are doing in their college and what they are doing in their hospital. Then I came to know this is not PharmD. This is not what PharmD means. PharmD is something different. Then I got a profile in LinkedIn, and then through LinkedIn also I got many friends. I just asked them what you are doing in US, UK, everywhere, US, Australia, and it is different in different country, even different states also it is different. In South India, I studied in South India, but now I am in North India. But it is different in South India and North India also. So now also I am searching what actual farm D is.
Okay,
No, I didn't get a very good answer for that.
it's okay, ma'am. Okay, so ma'am, you were saying about skills. So what are the skills one can opt for future purposes?
Skills, one is presentation skill. So you should be a very good presenter. If just a slide, we can make slides, we can make present PPTs, we can make slides, but how you present to that to the others. Like they should be knowing, they should understand what you are saying about. So one is the presentation skill, like this. Then in knowledge, one thing is that prescription, we know prescription pattern, prescription, how to write a prescription, everything. But it is all about practical skills. Like we know theory very well. We know the guidelines very well. We know the standard guidelines, how to treat a patient. According to the guidelines, we know everything. But what is practical skill? Practical skill is something different. So we need to improve our practical skill also. We need to go for in that first 1 year internship you are having. So for that 1 year, during that 1 year internship, we have to improve our practical skill, presentation skill, that kind of skills we have to improve.
Hmm.
Okay, ma'am.
So, ma'am, my next question is, what are the duties as a clinical pharmacist you do in your hospital?
In my hospital, first thing we are doing is medication appropriateness review. That is about medication errors. You may also be doing the same thing: prescription errors, administration errors. That is wrong dose, frequency, right drug, that kind of things. That is medication appropriateness review. Then we are doing chemo drug. Not we are not doing the calculations, because here we have the chemo pharmacists. We have specialized people for pharmacists. We specialized pharmacists for chemo pharmacists. So we are not doing the calculations, but we are auditing that, whether the drug is correct, dose is correct. Then according to the BSA, it has been given or not. Like that, we are checking. Then discard policy, we are checking. Like after dilution, also after dilution of the chemo drug, also something will be remaining in the vial. So whether they are discarding it in the proper way, and the storage of the drugs after reconstitution, also storage should be we have to look the storage 24 hours or 3 hours, 4 hours. So different for different chemo drugs, after reconstitution also different stability is there. So that also we are checking here. Then we are checking the opioid usage, narcotic drugs, narcotic discard, narcotic prescription renewal. After every 24 hours, we need to renew the narcotic prescription. These kind of things also we are checking. Then most importantly, AMS, antimicrobial stewardship. In that, we are checking for the restricted antibiotics, then surgical prophylaxis and empirical, that is escalation and de-escalation of the drug. So whether after the culture, they are escalating the drug, and after culture negative, they are de-escalation, whether they are de-escalating or not. These kind of things also we are checking. Then daily inpatient audits, then crash cart and cupboard audit. Medication cupboard and crash cart, emergency drugs. So monthly wise, we are checking the crash cart, that is emergency drugs, and the medication cupboard also. Medication cupboard, we'll checking by 1 week, weekly once we'll check. Then accreditation is coming, that is NABH, GCA, ACA, these accreditations are coming. Before that, we'll be looking into the possibilities, like what kind of error can occur, what is happening in our hospital. Then nurses administration errors are there or documentation errors are there. Then we'll be checking it and we'll be giving the training for that. If there is a documentation error, then we'll be training them not to do like this. This should be documented like this, and like that. Administration or also we are giving training for them. Storage also.
So it's just for the audience, like what you have said, it is all the important things you have to do in hospital. And for that, you have to study so hard, because when we talk about antimicrobial stewardship, you have to know about gram positive, gram negative, and so many things about antibiotics and high risk antibiotics. What are the high risk medications, sound like drugs, look like drugs? These are all the things which we want to focus as a clinical pharmacist in hospital.
Okay, so moving forward, my next question is, what is the one advice you would like to give to all the PharmD students?
So I have actually two advices. One is you should be updated knowledge. So daily you have to update the knowledge. Like even the old medications, although if all we know some medications, these medications are also having different mechanisms of actions. So we have all the we know about the medication mechanism of action and the pharmacological action of one drug. So now if today or yesterday or that last week, one more pharmacological action or one more use has been invented or discovered, then we should be knowing that. As a PharmD student, we should be knowing that we should be updated. So new drug came to the market. or new therapy came to the market, we should be updated. So that is a one main advice I wanted to give. Then don't just study for like don't just study for getting money, or just getting like just getting money and
To get
to
marks.
set up the life or settle in the life. Not for that. It's a social service also. We are in medical industry, so it is a social service also. Just think about your family and their family, others' family also.
So I'm moving to the next questions. Uh, what do you think about prescription rights for PharmDs?
That's actually a very nice question. Prescription rights for PharmDs. The thing is, first thing is, are we trained for prescription rights? Like, are we trained to write the prescriptions? No. Last 6 year, like the 1 year also, the 1 year of internship also, we are not trained in that way to write a prescription. But we know about the standard guidelines. We know about the treatment for a disease. So if we are getting a disease like, oh, okay, we are getting one disease, sepsis. So we know what to give for the sepsis. We know what to give for the MRSA, Staphylococcus aureus. So culture positive also, we know which drug to be given or which antibiotic to be given, but we don't know how to write a prescription. Even a patient is coming for fever also, we don't know how to write a prescription, but we know everything about the theory part. The standard guidelines we know. For the fever, what all things will be there, how to diagnose it, we will not be knowing. But therapy side, we know about the standard guidelines of fever. We know about the treatment pattern of dengue. Everything we know. But the thing is, we are not trained in a way to write the prescription. So first of all, before getting the prescription rights, I personally think that we should be trained in that way. In the 6th year, not till the 5th year. Till 5th year, we have to study the theory part. In the 6th year, even in the 6th year, that is internship time, we should be trained in that way to write the prescription. Then only we'll get if we are getting a prescription right, also we can write in a very good way, or we can do something. But unless otherwise we are not trained in that way, if we are getting the prescription right, also it will be misused.
Yes, ma'am.
It will be misused. Of course, it will be misused. This is my personal opinion. That if we are trained in that way to write the prescription for this disease, this is the prescription, and this patient specific, this is the disease, and this is the patient problems and every pharmacokinetics of the patient, and this is the prescription for the patient. If we are trained in that way, then prescription rights, if we are getting the prescription right, we will be using it in a very good way. That is my personal opinion.
Yes, ma'am. It's the right thing. We are not trained we are not trained in that way to write prescriptions, because
Yes.
our main focus is to learn about the classification and mechanism of action, pharmacotherapy, biopharmaceutics, half-life of the
If you know the pharmacology and the pharmacokinetic, we can write the prescription. But the thing is, we are not trained in that way. That is, practical skill is not there. Theoretically, we know everything, but practical skill is there, not there. That we need to urge.
Yes, ma'am.
So, ma'am, my next question is, what are the job fields PharmDians can explore?
Okay. Job fields, first of all, clinical pharmacy, clinical pharmacologist. It is a very nice job field. Clinical research coordinator, clinical research associate. Then in pharmacovigilance also, pharmacovigilance, adverse reactions, that monitoring everything. Then those who are interested in literature review, reading the literatures, then meta-analysis, those kind of people, those kind of students can go for this kind of medical writing. And after PharmD, we have to do a course for that, I guess. 6 months or 3 months course is there for medical writing. After that, we can go for that also. So it is not about a job like after PharmD, we need to go like we need to get a clinical pharmacy job, or we need to work in a hospital. It is not like that. What is your interest? And those people who are doing MBA also are there. So people who are doing MBA after PharmD, and they are going to business field, some other field, pharmaceutical industry field also. And after PharmD, we can go for higher studies also. After PharmD, those who are getting dual degrees, dual masters. Some people are there who are doing masters in clinical pharmacy, masters in pharmacology, masters in some other subjects like business management. Different degrees are there. That we will get a dual degree. We are already having a PG degree with us. Along with that, we'll get a one more master's degree. So those who are interested in higher studies, those who want to gain one more degree, then they can go for that also. PG, PhD also we can go for PhD also. So there are many job opportunities after PharmD. We can, if we are interested in teaching field, we can go for assistant as an assistant professor. Then as associate, we can go for that also. So it is all about your interest, which field you are interested in. If you are interested in clinical pharmacy, if you want to update knowledge in clinical pharmacy, we can go for that. Otherwise, you can go for a research field or as an assistant professor also we can go for. It is according to your interest, you can opt your future.
Okay, so my last question is, what are the changes you would like to suggest in PharmD?
Changes I would like to suggest. That is the 6th year, that is the internship time. We need to be trained in a better way. So till 5th year, we are having a syllabus, and according to the syllabus we are studying. We are mentored, or mentors will they will be guiding us in that way according to the syllabus. We will have, if we are having a syllabus, we can go for that as a protocol, as an instructions are there. We can study that and we can go for the exams. We can improve our academics, qualification, everything. But the thing is, 6th year we don't have a syllabus. So in the internship year, we should be trained in as a perfect PharmD student, or as a perfect, if we should be trained as a clinical pharmacist or a clinical research. Everything should be there. So research should be there, or clinical pharmacist, because all the 30 students are not interested in clinical pharmacy field. So we should be trained in different ways. So everything we need to know. Even the clinical pharmacist should know about the research. In the hospitals also, clinical trials are going on, clinical research is going on. So we need to be trained in both the ways, clinical research or clinical pharmacy. Everything we need to be trained. So we should have a syllabus. That is the one thing that I would like to change. We should have a syllabus for the 6th year, that is for the internship, and we should be trained in a way to. We had a question like prescription. If you want to write a prescription, we should be trained in that way. So prescription also, we should be trained in that way, that for this disease, we should be this is the prescription for that. So according to that, we have to be trained from the doctors, experienced doctors and PharmDs. Not only the clinical pharmacist or PharmDs should train us, doctors can also train us. When the doctors, we are all in the medical field, even the nurses can train us for the administration things, administration errors. To prevent the administration errors, experienced nurses will be there. If the nurses are having 15 plus years of experience, they will be knowing more about administration than us, because we are just freshers. So these people can train us during our internship, so that we will get more knowledge about that. Those who have experience, it is better to trained from an experienced person rather than a simple, like just assistant professor. They will be having just one degree and they came as a fresher. So it is better to get trained from an experienced one. That is the one thing I like to change.
Yes, ma'am. Thank you, ma'am. Thank you for your time, ma'am. And we would like to do another podcast with you on the presentation, how to make presentation. Like we use so format for the presentations. So most of the people don't know about the how to make presentation presentable. So
Yes,
I'd like to do a podcast with you on that.
sure. We'll think about it.
Okay,
Thank you
ma'am.
so much, ma'am, for your time.
Thank you so much for inviting me also. Thank you.
Thank you, ma'am.